Hi, it's me, Ingrid INFP, and this is a video I didn't think I would be making, but I did make a video about do INFPs have ADHD, and this is kind of a continuation of that, which is do INFPs have autism? Obviously, not all INFPs have autism, and not all autistic people are INFPs, but it might be something to consider if you happen to be an INFP, to go check out if you have autism. What has been happening to me is that I'm in a burnout. I told my supervisor on Thursday, which is a few days ago, that I wasn't feeling good. I'd planned this. I'd planned that I was going to tell her this. But then what happened like a half hour before I was supposed to have my weekly meetings with her, is that the person who's in charge of my program is a residency director, and my boss asked me to stay over after the doctor's meeting, and said that they wanted to see me deliver my plan for my 5-year residency. And I've been procrastinating this for 4 months, okay? It's just that they happened to decide now that now was the time to do it. And I was like, oh shit, I'm already going to be telling my supervisor that I don't feel good. I've been procrastinating that as well. And now they're giving me this. So I was just like, yeah, okay, I'll do it, you know? As the usual people-pleasing person I am. But then when I came in and told my supervisor, I started crying. I said I told her about the putting the incident with me almost burning my house down, and I told her about that I can't think, and I'm really sensitive, and that I might have burnout. And she told me go take some time out now before it's too late, you know. She said, are you okay with being at work? I said, yes, I'll be fine. So I worked the rest of that Thursday, the afternoon, and that went well. And then on the Friday, when I came to work, one of my other colleagues, who is also struggling with burnout, was sick that day. So then I was alone with the doctor that I hate in the afternoon. And we just changed to the new infection clinic, which was pretty stressful because I have to deal with a new environment suddenly. Anyway, I managed to deal with that Friday, and then yesterday, on Saturday, I did what my supervisor told me to do, which was go see my friends in Stockholm. My supervisor wanted me to stay over at their place and recuperate. I have a time booked with a counselor that's coupled to my work, so it's like an outsider person. I also have a time that's going to be booked at my regular health clinic, like any civilian, you know. It's just that I do know some of the doctors that work at that place, and I don't want this to affect my job relations. So that's why I'd rather go to this time that I have next week. Anyway, all of this to say that I told my best friend, my ISFJ best friend, we went and ate cream bun. It's called a semla. It's what they eat for Mardi Gras in Sweden. And we went to the same place where my parents went when I was little. And it's a pretty nice place. But so I was telling my friend this, and he's known me for a long time, almost 10 years. And he has worked in psychiatry. And he said, Ingrid, do you want to know what I think? I was like, I'm not sure right now because I'm crying, And he said, well, I don't know if we're thinking on the same lines. And I said, we're probably not thinking on the same lines. So he said, okay, do you want me to tell you or not? And I said, okay, tell me, like, I can't go lower than this. And he said, well, I think as a person who has worked with people with ADHD and autism, that you might have autism or ADHD. And I was like, yeah, I mean, I've thought of that. I don't know if I relate to it. Also, he's an ISFJ. So keep that in mind, that for him, an INFP is pretty much somebody who is dysfunctional by nature, So I don't know what is the INFP and what is the whatever the other thing is. But so I scored a test this morning, a free test on idrlabs.com. This isn't a regular test. And it scores for autism. But obviously certain of these aspects are actually aspects of other disorders. So I do have depression, I do have anxiety, and that kind of affects the results. So according to this, I had a high probability of having autism, but the things that I scored the highest on were depression and anxiety. So obviously maybe I just have depression and anxiety, and all the rest is just INFP stuff, I think that I relate a little bit more to having ADHD than having autism, but who knows. I also have an internet friend from Tumblr that I've also known for 10 years, or even more than that. I've maybe known her for like 15 years. And she used to be on Tumblr, and she's the one who got me to go to a counselor all those years ago, because she got help by taking antidepressants, and she got help by going to a counselor. I did end up going to a counselor with my school, but it was not great, so I didn't continue with that. And also trying antidepressants was not great either. I got side effects that were not great. So I was asking her as well, because she just got the diagnosis ADHD and maybe is still under testing for autism. And it explains a lot. But the thing is, she's also an INFP. She doesn't really believe in MBTI anymore. But there is some kind of correlation there. A lot of people in my comments have been saying that they maybe have autism. What are the things that this test checks out? This test looks at depression and anxiety, which is what I scored most on, mostly anxiety. Fixations, like we do tend to get obsessed about certain things. And I think that as INFPs, we do that as well. It's just that I think that if you have autism, you're more likely to overcompensate, You're just like, be super into one thing. I think INFPs have more of a tendency to just like jump from thing to thing, and not really have the time to fixate on one thing. But it does happen, because that's what INFPs call their passion, their passion in life. I do have some kind of obsession with trains, which, sounds a little bit like a autistic trait. But I'm open to the possibility of this. It's just I do relate more to ADHD. Then the next one is abnormal flat speech, which I don't relate to really. But it is abnormal in that I do speak sometimes too quietly for people to hear on this YouTube channel. And sometimes I speak too loudly. So that's kind of a thing that I do. I don't have a flat speech, I don't think. I'm pretty animated when I talk. But so yeah, I don't relate to that. Noise sensitivity, yes, I relate. That's what kind of triggers my, if I ever have a panic attack, which isn't often, it's often because there was too much stimulation, too much noise, something was too much. That's why I had a panic attack at Pride one year, because my ISFJ friend wanted us to go closer to the speakers, and I was like, no, I don't want to go closer to the speakers. But then I kind of, had to follow them because I didn't want to be isolated. And then we came under a tunnel in the microphones, and that was too much. I also dislike having a lot of children around, not because they're not like great, like imaginative little beings. It's because like they make a lot of noise, and that also is why dogs scare me a little bit, because their barking makes me jump. So I do relate to noise sensitivity. Social difficulty, I do have trouble with social stuff, but I've always attributed that to social anxiety. I do have trouble making friends and meeting new people. I've gotten much better with time though. But it's just like I'll always stand out. I'll always be weird, you know. The people who like me and that I can interact with socially, they have to kind of adapt their view of what a person is before they can talk to me. So yeah, maybe not. Anxiety, yes, I have anxiety through the roof. Abnormal posture. Well, it's not like I have a super abnormal posture, but I don't stand up straight like at all. I've always thought that it was because I have social anxiety and I don't want to take a lot of space. So my back is always kind of low, and I walk weirdly according to certain people. I don't know. Poor eye contact. Yes, I do relate to that. I can do eye contact and it's fine. Or fine. I don't really like it, but most of the time I can concentrate better if I'm not looking somebody in the eye. So I usually look down at the floor, or I look at my desk or that kind of thing when I'm talking to a patient. And sometimes patients get like mad because they think I'm not listening because I'm looking somewhere else, when actually I'm listening more intently by doing that. Otherwise, if I'm looking at their eyes, it's like I'm thinking about what they're feeling rather than what they're telling me about. So yeah, I don't know. I mean, yes, poor eye contact is a problem that I struggle with, but I don't know if it's just, I don't know why. Tics and fidgets. Well, I did talk about stims on one of my videos. I don't really have a tic or something. I do touch myself a lot on here and my hair and stuff. I also stroke my legs like sometimes, which is what I'm doing right now. So I do get that a little bit. I do get fidgets, I guess. Like there are certain things that I have to do. Like I can't have my hands just like idle. They are doing something while I'm talking all the time. But I don't do the like talking, like rocking back and forth is not really something that I do. unless I'm having a panic attack or something like that. So I don't know. Aggression was the least. I don't think I'm an aggressive person. When I get angry, I usually keep it inside, or I cry. So I don't throw things. I don't hit things. It just feels like that would hurt more. So yeah. So I don't know. This test is not that great, but I can see why INFPs would relate to certain of these things. But is it social anxiety or is it autism? Is it ADHD? Hard to say. I do relate to certain things. The sensory issues is a problem. That is what my ISFJ friend was worried about, because, well, he once he came into my house when I was like in the fits of depression, and he just had to go and clean all the dishes because he couldn't stand it. And I was telling him, like, I don't like touching I don't like touching the dishes. It's gross, you know? Like, I have gloves to do the dishes, and it's slightly better, but I don't like feeling my own sweat inside these gloves either. So I do have like these sensory things. The clothes I wear are very. This is something that my friends have picked up on, that like my shirts are not for the aesthetic, it's for like the feeling that they give me, both sensory and feeling wise, you know. I can't wear stuff that is uncomfortable. It's just an extra thing to think about, you know. So he did say, like, you know, you have these sensory issues, you have to keep adapting your life to all of these problems that come up, and that's exhausting. And so maybe it's no wonder that you have depression and anxiety if you keep having to work around all of these things in your life. And I was like, yeah, I mean, makes sense. It's just, I'm not really sure about it, because it can be explained by other things. But yeah, so that's all I had to say. This video is getting long. Tell me what you guys think. Maybe you have autism. I mean, I have seen some of you guys in the comments saying that you have autism, so we're not alone. I think that also, if you've there was a poll on Tumblr which said, which asked, like, are you queer? Are you are you LGBT? Are you autistic? Are you are you neurodivergent? And like, obviously the sample size, so many people were the people on Tumblr are all pretty much neurodivergent in some sense. So I think that the people who are watching my videos have a bigger percentage of you guys will be having autism than the INFPs who are in the wild. But I'll say it like that. If there are any INFPs who are in the wild, you know, I think a lot of us are drawn to these kinds of platforms. But yeah, tell me what you guys think. Bye.